In the name of God, the compassionate and the merciful. Hello, everyone. I hope you're fine and everything goes well and you're away from the coronavirus. This is Mustafa Purhaji, and I'm gonna be with you with the first unit of Specialized English 1 Introduction to Medical Practice. In order to make the class more interactive and interesting, I have decided to invite one of my former students, Michael Sadiqi. Hello, Michael. How are you?
Hello, and thank you for having me here.
Thank you very much as well.
You're welcome.
So the first reading is the modern day physician. So this is the very first paragraph, the introduction paragraph. Here I have underlined the topic sentence which encapsulates the main idea of this paragraph. I have also actually highlighted the important words within this paragraph. They are colored in red. Michael, could you please read through the text?
Sure, why not? The practice of medicine has changed in significant ways since the first edition of Harrison's book appeared in 1950.
So this is the main idea. So we have had changes in the practice of modern medicine.
The advent of molecular biology, with its enormous implications for the biological sciences, the sequencing of the human genome, sophisticated new imaging techniques, and advances in bioinformatics and information technology have contributed to an explosion of scientific information that has fundamentally changed the way we define, diagnose, treat, and prevent disease.
So the question here is, what has made this change in the practice of medicine possible? What were the changes? So the first one was the advent of molecular biology. Advent here means
The start,
or the appearance
yeah,
of the start of. So molecular biology with its enormous implications. Enormous means huge.
yeah, big, gigantic,
Yeah, and
and
implications
implications
mean
are
effects, and
yeah,
then usually positive
effects.
effects. Yes. For the biological sciences, sophisticated
It's
means here
complicated.
complicated, and advances in bioinformatics and information have contributed. It means helped
Yeah.
an explosion of a lot of scientific information that has fundamentally, essentially changed the way we define, diagnose, treat, and prevent disease. And finally, it continues. So, here, the last line, it says that this knowledge is not static. It means it's not fixed, it is dynamic. And it continues to intensify with time. It means increase and augment with time. So this is the second paragraph, and again, the main idea of this paragraph is in the very first sentence. Could you please read the first sentence?
Well, the widespread use of electronic medical records and the internet have altered the way we practice medicine and exchange information.
So here we can see the very important role that the digital world, especially the internet, has played in medical science and medicine very specifically.
As today's physician struggles to integrate the copious amounts of scientific knowledge into everyday practice,
So here, copious means
a lot.
a lot, and integrate means
To
combine.
yeah, combine and mix.
Yes, and it struggles to here means is trying to. So the physician is trying to mix or combine the lots of information that we have into everyday practice.
It is important to remember that the ultimate goal of medicine is to treat the patient. Despite more than 50 years of scientific advances since the first edition of this text, it is critical to underscore that cultivating the intimate relationship that exists between physician and patient still lies at the heart of successful patient care.
Yeah, so here it is critical. It is very important to underscore that, to emphasize that cultivating here means
To nurture, to make, to
to,
build.
to build the intimate relationship that exists between physician and patient still lies at the heart of successful patient care. So it means this is a very important key that we need to look for. And that key is nurturing or building a very close relationship or kind of rapport between the physician and the patient. This paragraph starts with a subheading, and this subheading can help us predict the content of this paragraph, the science and art of medicine. So here we can predict that this paragraph is about the role of science in medicine. And the main idea of this paragraph is again in the very first sentence.
Science based technology and deductive reasoning form the foundation for the solution to many clinical problems.
Foundation here means
Base, yeah.
basis. Yeah, the basis for this.
Spectacular advances in biochemistry, cell biology, and genomics, coupled with newly developed imaging techniques, allow access to the innermost parts of the cell and provide a window to the most remote recesses of the body.
So here, spectacular means
Amazing, like
yeah, advances, and
breathtaking.
coupled with means together with.
Yeah.
Revelations about
Revelations about the nature of genes and single cells have opened a portal for formulating a new molecular basis for the physiology of systems.
yeah, revelations here means
Findings.
findings exactly.
Increasingly, we are understanding how subtle changes in many different genes can affect the function of cells and organisms.
And organisms, yeah. How subtle here means how
Intricate, like,
yeah, or minute
yeah.
changes, very small changes.
We are beginning to decipher the complex mechanisms by which genes are regulated.
Regulated, exactly. So here again, decipher means
Decode,
understand.
yeah, decode. We have developed a new appreciation of the role of stem cells in normal tissue function and in the development of cancer, degenerative disease, and other disorders. The knowledge gleaned from the science of medicine has already improved and undoubtedly will further improve our understanding of complex disease processes and provide new approaches to disease treatment and prevention.
So this is kind of a conclusion to this paragraph. So it's restating the main idea. The knowledge gleaned from means
Gathered from,
gathered
collect from,
from.
yeah. Yet skill in the most sophisticated application of laboratory technology and in the use of the latest therapeutic modality alone does not make a good physician.
So this paragraph is about what the physician is supposed to do when a patient comes with a clinical problem.
When a patient poses challenging clinical problems, an effective physician must be able to identify the crucial element in a complex history and physical examination.
So these are the measures that the physician is supposed to take
To order the appropriate laboratory tests and to extract the key results from the crowded computer printouts of the data to determine whether to treat or to
or to
watch.
watch. And crucial here means,
Very important. Deciding whether a clinical clue
for example, taken from the laboratory test.
is worth pursuing or should be dismissed as a red herring, and weighing whether a proposed treatment entails a greater risk than the disease itself are essential judgments that the skilled clinician must make many times a day.
Yeah, exactly. So here, um, a red herring means a distractor. Deciding whether a clinical clue is worth pursuing, it means the physician is supposed to work on it and pay more close attention to it, or should be dismissed or disregarded as a red herring, as a distractor. And also deciding upon the treatment entails a greater risk. Entails means includes a greater risk than the disease itself are essential judgments that the skilled, experienced, an experienced clinician must make many times each day.
This combination of medical knowledge, intuition, experience, and judgment defines the art of medicine, which is as necessary to the practice of medicine as is sound scientific based.
And this is the pivotal sentence here the very important sentence that we have in this paragraph. So this paragraph starts with a subheading, which can again help us understand the and predict the content of this paragraph. First of all, it defines what evidence-based medicine is.
Evidence based medicine refers to the concept that clinical decisions are formally supported by data, preferably data that are derived from prospectively designed, randomized, controlled clinical trials.
Trials. Derived from means,
It is somehow, it comes from, it originates from.
yeah, they are taken from.
This is in sharp contrast to anecdotal experience, which may often be biased.
Anecdote, it is in contrast to, it means it is unlike.
Yeah.
Anecdotal experience means experience which is
Based on
based on,
anecdotes and short stories heard from here and there.
yeah, which can may often be biased. Biased here
Means
means
prejudice. It's not true. It's just somehow based on somebody's own ideas.
an opinion based on opinions,
Yeah.
ideas and opinions. They are not objective.
Unless they are attuned to the importance of using larger, more objective studies for making decisions, even the most experienced physicians can be influenced by recent encounters with selected patients.
Exactly. So here, if unless the pronoun they refers to
The physician, the most
physicians,
most
yeah,
experienced
physicians.
physicians. It
So
comes
they refers
after.
to physicians.
Yeah,
If they are not attuned to, it means they are not
accustomed to
accustomed to. They are
and
they
in
don't.
agreement with.
Yeah, they are not in the habit of.
Yeah,
So it means that if they are not in the habit of, if they are not accustomed to using objective data, they may be sometimes biased.
yeah. Evidence based medicine has become an increasingly important part of the routine practice of medicine and has led to the publication of a number of practice guidelines.
So as you can see, the previous paragraph ends with the role of evidence-based medicine in actually providing some practical guidelines. So that last sentence can help us predict the content of the next paragraph, which is actually the current that paragraph that we are looking at, practice guidelines. And the very important sentence that we have, or the main idea, is actually the very first one. So go ahead, please.
Professional organizations and government agencies are developing formal clinical practice guidelines to aid physicians and other caregivers in making diagnostic and therapeutical decisions that are evidence based, cost effective, and most appropriate to a particular patient and clinical situation. As the evidence base of medicine increases, guidelines can provide a useful framework for managing patients
So
with particular.
these are the functions of guidelines. These are the functions of actually practice guidelines. Guidelines can provide.
A useful framework for managing patients with particular diagnoses or symptoms. They can protect patients, particularly those with inadequate health care benefit, from receiving substandard care.
Yeah. So here, inadequate means not enough. So this is another function.
Guidelines can also protect conscientious caregivers from inappropriate charges of malpractice and society from the excessive costs associated with the overuse of medical resources.
Conscientious caregivers. Conscientious are those people who are concerned about ethics. And here, charges, accusations of malpractice. Malpractice, it means,
Wrongdoing, yeah.
especially in medicine.
There are, however,
So
caveats.
so far we've been talking about the functions of guidelines. Now, here we have however, so we want to change the topic. Here we have some warnings that we should pay attention to.
There are, however, caveats associated with clinical practice guidelines since they tend to oversimplify the complexities of medicine.
So this is the very first warning, the very first caveat. They simplify or oversimplify the complexities of medicine. The second one is
Furthermore, groups with differing perspectives may develop divergent recommendations regarding issues as basic as the need for periodic sigmoidoscopy in middle-aged persons. This is very specialized term.
sigmoidoscopy.
Yeah.
Yeah, so here it says that people may have different interpretations of the guidelines. They may have divergent recommendations. It means totally different opinions and suggestions.
Sorry.
And finally,
Finally, guidelines do not and cannot be expected to account for the uniqueness of each individual and his or her illness.
yeah, so most of the time they are one size fits all. And it says that they cannot take into account the uniqueness of each individual.
The physician's challenge is to integrate into clinical practice the useful recommendations offered by experts without accepting them blindly or being inappropriately constrained by them.
Constrained by them is limited by them.
Yeah.
Well, this paragraph has to do with a very important responsibility of the physician, which is decision making in terms of both diagnosing the disease and treating it.
Medical decision making is an important responsibility of the physician and occurs at each stage of the diagnostic and treatment process.
So here we have, so that was the importance of medical decision making. Now we want to see what it involves and what this requires.
It involves the ordering of additional tests, requests for consults, and decisions regarding treatment and prognosis,
Prognosis here means,
predicting the illness in future. This process requires an in-depth understanding of the pathophysiology and natural history of disease.
yeah,
As described above, medical decision making should be evidence based so that patients derive the full benefit of the scientific knowledge available to physicians.
yeah, you derive the full benefit, it means uses the full benefit.
Formulating a differential diagnosis requires not only a broad knowledge base, but also the ability to assess the relative probabilities of various diseases. Application of the scientific method, including hypothesis formulation and data collection, is essential to the process of accepting or rejecting a particular diagnosis.
So sometimes we have a hypothesis about the diagnosing a disease. So in order to accept or reject that hypothesis, our opinion, our conjecture, we need to apply scientific method.
Analysis of the differential diagnosis is an iterative
It is
process.
an iterative process. It means it is not
It
linear.
yeah, it
Sometimes we need to go,
entails going back and forth,
yeah,
several
sometimes we need to
times.
go back and see, or sometimes we need to order some other tests.
As new information or test results are required, the group of disease processes being considered can be contracted or expanded
Exactly.
appropriately.
Contracted here means narrowed down, or no, expanded. It means sometimes we need to add some more information to it. So here we have the second reading, the principles of patient care. And the subheading that we have here is care of the elderly. As you know, a large proportion of the population these days are just old people. So we need to know how medicine or the practice of medicine can take care of those individuals and elderly population in general. So go ahead, please.
The relative proportion of elderly individuals in the populations of developed nations has been growing considerably over the past few decades and will continue to grow.
So the population is aging.
In this regard, the practice of medicine will continue to be greatly influenced by the healthcare needs of this growing elderly population. The physician must understand and appreciate the decline in the physiologic reserve associated with aging.
So these are some important points that the physician needs to take care of.
The diminished responses of the elderly to vaccinations, such as those against influenza,
So this is the first decline in physiologic reserve associated with aging, the diminished response, reduced, mitigated.
the different responses of the elderly to common diseases and disorders that occur commonly with aging, such as depression, dementia, frailty, urinary incontinence, and fractures.
Right, these are the negative outcomes of aging. This paragraph is very specifically about the measures that we need to take to reduce medical errors and also to improve patient safety.
A report from the Institute of Medicine called for an ambitious agenda to reduce medical error rates and improve patient safety by designing and implementing fundamental changes in healthcare systems.
Yeah, agenda is list of actions that we need to take.
Adverse drug reactions occur in at least 5% of hospitalized patients,
Adverse means negative, bad.
and the incidence increases with use of a large number of drugs. No matter what the clinical situation, it is the responsibility of the physician to use powerful therapeutic measures wisely and with due regard for their beneficial action, potential dangers, and cost.
Yeah, no matter he is whatever the clinical situation is, and with due regard for it means with enough attention to.
It is also the responsibility of the hospitals and healthcare organizations to develop systems to reduce risk and ensure patient safety.
Yeah, this is the measure that we need to take in order to improve patient safety.
Medication errors can be reduced through the use of ordering systems that eliminate misreading of handwriting.
Yeah, this is what we need to do in order to eliminate. Eliminate here means remove.
Delete.
Yeah.
Implementation of infection control systems, enforcement of hand washing protocols, and careful oversight of antibiotic use can minimize complications of nosocomial infections.
Infections related to hospitals, and minimize means reduce. Here, this paragraph tries to say that throughout the diagnostic or therapeutic processes, the physician must pay attention to ethics, especially the patient's rights and the consequences, the benefits, the risks, so on and so forth. So, the role of the physician in the informed consent of the patient. Informed consent, it means consent here means agreement, and we need to gain that agreement.
The fundamental principles of medical ethics require physicians to act in the patient's best interest and to respect the patient's autonomy.
Autonomy here means independence, and best interest here means benefits.
Yeah. This is particularly relevant to the issue of informed consent. Most patients possess only limited medical knowledge and must rely on their physicians for advice.
They possess, it means they have.
Physicians must respect their patients' autonomy,
Autonomy here means independence,
fully discussing the alternatives for care and the
the
risks,
options that they have,
benefits, and likely consequences of each alternative.
the outcome. So here it says that we need to provide the patient with enough information. So that's informed consent. So as I said earlier, we need to receive the patient's consent. So we need to provide the patient with a form in which we have enough information about the therapeutic and the diagnostic processes.
Patients are required to sign a consent form for essentially any diagnostic or therapeutic procedure.
So agreement form.
In such cases, it is particularly important for the patient to understand clearly the risks and benefits of these procedures. This is the definition of informed consent. It is incumbent on the physician to explain the procedures in a clear and understandable manner.
Incumbent here means it is incumbent on the physician. It means it is the responsibility
Responsibility.
of the physician to explain this.
And to ascertain that the patient comprehends both the nature of the procedure and the attendant risks and benefits.
Yeah, ascertain here means understand. Attendant risk, the risks that come with it.
The dread of the unknown inherent in hospitalization can be mitigated by such explanations.
And the dread of the unknown, it means the fear of the unknown, especially the fear related to hospitalization, staying in the hospital, can be mitigated, reduced
Yeah, allied.
by such explanations that we can have in the consent form. Thank you, Michael, for joining me, and thank you all for listening to us. Have a
You're
good time.
welcome. You're welcome. And it was a great honor to be here.
Bye bye.